You're listening to Head On with your host, board-certified plastic surgeon, Dr. Bahman Guyuron.
Rhinoplasty is designed to improve the aesthetics and function of the nose. And that's one of the things that's actually emphasized to the other plastic surgeons when I speak about rhinoplasty, that we really need to first detect the problem. Sometimes actually the patients don't know that they have a breathing problems because they're breathing through their mouths and they don't know that actually the physiologic way is to breathe is through the nose. And they're not lying to us, they're just used to it. So it is our obligation to detect when the patient is sitting across me. I'm watching how's their breathing. Actually, can they actually keep their lips closed for a period of time? So that's the first step in helping these patients. I'm very focused on function, and it doesn't really make sense to create a nose that looks good but doesn't function. So the goal is a combination of improving the shape, improving the function. In fact, most of the time, form translates to function, meaning when we make the nose to look right, it's going to be functioning properly as well. But some of the issues are deep inside and you can't even see them from the outside. And we need to be able to fix those as well. When is the right time to do the surgery? And those who are experienced usually do not do rhinoplasty on a male person, a boy, earlier than age 14, and for a female, age earlier than 13. But there are sort of loose guidelines. And also the other end of the extreme, meaning older patients, as long as the health is good, we can do rhinoplasty at any age. But obviously, at a certain age, their skin becomes so thin and the also health is so suboptimal that rhinoplasty is not a good choice. But between those two limits, essentially we can do rhinoplasty on everybody. The type of rhinoplasties that individuals can undergo varies from surgeon to surgeon. For example, some surgeons exclusively do closed rhinoplasty, meaning they don't make a small incision in the column between the nostrils. There are surgeons that who do exclusively open rhinoplasty, and most of us do almost exclusively open rhinoplasty, but occasionally do closed rhinoplasty. Even within the closed and open rhinoplasty, there's a category of preservation that has gained more recent popularity, although it is not anything new. It is something that is over 100 years old. The ultimate goal is to deliver the best result that every surgeon can deliver. Technical variations make some difference, but not really a major enough difference to be the reason for the patients to decide, okay, if you don't do open rhinoplasty, I'm not going to have you to do the surgery. If you're not doing preservation, I'm not going to do the surgery by you. They have to select a surgeon who has experience enough to deliver a good outcome, regardless of what technique that person is going to use. But for many of us who do open rhinoplasty, it is about the precision, meaning control and being able to see what we are doing and setting the frame exactly the way we want. When you do a closed rhinoplasty, you don't have as much control and as much precision as we can exercise when we do a open rhinoplasty. But again, it is not to say that closed rhinoplasty is wrong, as long as it is being done by someone who's experienced. If anyone is interested in a rhinoplasty consultation, you can call our clinic, Ziba Clinic, 440-461-7999. Again, 440-461-7999. Or you can go to my website, drbahmanguyuron.com, And you can actually make your appointment through the internet. We're here to serve the patients.
Links to learn more about Dr. Guyuron and anything else mentioned on this podcast are available in the show notes. Head On is a production of The Axis, THEAXIS.io.